My story starts on November 9th, 2006, when I was 58 years old, and I went to my gynecologist for the regular yearly checkup. During the exam, she told me that my uterus seemed enlarged and sent me for a transvaginal ultrasound, which showed that I had a 10-centimeter cyst on my right ovary. Then she sent me to have this CA-125 blood test. That came back elevated at 177, but not, which is well above the 1 to 35, which is normal, but really not as elevated as some women have when they have cancer. So she wasn't sure if the cyst was cancerous, but she felt to be safe that she should refer me to a oncologist, which she did. And after meeting with him, I had surgery in December 2006. Prior to going to her, I felt like I had no symptoms. When I think back about it, I had had an increase in urinary frequency, and I had a sense that my stomach was a little larger, a little more bulgy than usual, but I hadn't gained any weight, and I was aging, and that's what I attributed that to. So I was totally surprised about the cyst. The doctor operated and removed the cyst. The cancer had spread to the other ovary. I had a total hysterectomy, and it was stage 3. Before I began chemo, the doctors talked to me about a study, a clinical trial, testing Avastin and its effectiveness with the other 2 mainline drugs, which was cisplatin and Taxol. And I agreed to go ahead and be part of that study. So for 5 of the 6 sessions with Taxol and cisplatin, I also had either a placebo or Avastin. And then from that point on, I went for almost another year receiving an injection, or infusion every 3 months. Every 3 weeks. An infusion every 3 weeks of either Avastin or the placebo. So I just finished that in May of this year. Central to my recovery was not only the support of my family and my friends, which was tremendous, but also the physicians that I had were very open, very honest, very not just caring but respectful of my concerns, listened well, took a lot of time with their patients, all of us, responded when we needed help. So, that just became so important, and, I felt like I could trust them, that they were making the right decisions for me. My story could have been a lot different if I had heeded those small symptoms and gone to my doctor earlier to check it out. They might have caught it earlier. But it could have been a lot worse if I had not kept regular checkups. And I think there are a lot of women, especially once they get to menopause, who just stop going to gynecologists. And I think for me, from my story, that's probably the main thing I would want people or women to know, that you should keep up those checkups, because you never know. But right now I'm doing well, and I'm just grateful for every day.